Hello, everyone. It's Matthew McKenzie here again, and this time I'm going to present on a fairly deep and tricky subject. Now, if you already know me, judging from my videos and my care's website, I raise awareness of unpaid carers, but due to lived experience, hence actually caring for someone living with mental illness, I have been involved in many mental health NHS trusts, and I still am by the time of this video. And I've learned quite a few things and learned from others who have also been involved. Um, this is not going to be an easy lecture, unfortunately. There's so much involved in this, and I'm not doing it as much justice as I can because in the end, really, there's so much more to it. But anyway, holding your NHS Mental Health Trust accountable, a guide to carers. And this basically means that if you're helping to shape the mental health services for the person that you care for and yourself as carers, these are steps or ways to do it. I'd say ways to do it rather than steps, because I just don't have the time to cover it in this lecture. I'll probably do it in separate lectures later on during the year. So before we continue, actually, what I want to mention is that if you enjoy the content or feel that you might be getting stuff useful out of it, please remember to subscribe. Keeps this channel open and available for others to learn things from. And even if you don't feel like you learned from it, you can always have a discussion, because stimulating discussion with other parties. But yeah, I need a subscriber. So subscribe and like the video. But anyway, going on, how do you hold a massive organization that provides mental health services to your area if you are caring for someone using those services? Those being mental health trusts, and there are different ones. They don't all work the same. They have some are specialized, some aren't. So, um, but it's so important that I feel if you have the chance, that you should try and get involved in helping to shape services. There are many ways to do it. Obviously, some mental health trusts have involvement registers. When I say involvement, it means you're paid for your time in some sense. Not always. You might just be there just to give your views on how mental health services has affected your caring role. But if someone's developing or shaping services, they can't just develop them at a whim and guess. They should really be asking patients, service users, families, friends, and unpaid carers. When I say friends, I'm not talking about the friends of the NHS professionals. I'm talking about that you may have a friend caring for someone living with mental ill health. The reason why this lecture is really tricky is because not only are mental health carers not trained to provide care and support to someone living with mental illness, they're definitely not trained in holding the mental health trust to account, probably due to resources, probably time, um, and sometimes you just have to learn as you go. The advantage really is that you're not held accountable fully yourself. Obviously, there's rules and regulations to follow, being respectful to staff and others who are involved as carers and patients on helping to shape mental health services. But no matter what happens in the future, there'll always and should be a chance for patients, service users, and carers to help shape those services. It's not an easy task, and as it stands, only very few actually do this. But if you're thinking about this or are involved in shaping services, then this lecture is for you. So, as a reminder, carers they actually play a critical role in supporting individuals who rely on those services. So they have a right to hold their NHS Mental Health Trust to account, whether it's for quality or effectiveness of care or even both. And a lot of it really is down to almost care awareness training, but the size and complexity of these NHS trusts demands, in some sense, that you inquire about the quality of, and effectiveness of care. The risk is if you don't hold your trust to account on these things later on down the line, when there's delivery of those services, the quality and effectiveness may not be so good. And who's in the firing line? Well, it's going to be your loved one and yourself. So, I take my hats off to those who step up and hold the NHS Trust to account. The reason to hold, obviously, those quality and effectiveness of care, not just from what I've stated in that warning, but basically it ensures the needs of both your loved one, the person receiving care, and the carers themselves are met. So here are some areas that you can hold your NHS Mental Health Trust accountable, whether you're involved at a high level. I used to be a carer governor for my local mental health trust, but you don't have to be. You can still be involved and give your views. But the thing is, a lot of the things mentioned here, carers are not told about, and it's up to yourselves almost to sort of say, what about this? And that way they should respond. There are things, unfortunately, which would be very difficult to get hold of, and I'll look at another lecture on that. There are lots of things that are very, very difficult to get hold of regarding the quality and effectiveness of your mental health trust services. But this won't be covered in today. So the first thing you can always, this is not always the first thing, but one of the things anyway, going along in this section, I think I'll cover around about 12, but this is access to timely and appropriate care. There'll be, I'd say, sub sections regarding this. So waiting times. If you're caring for someone who's living with mental illness, you should ensure that your NHS trust is providing timely access to mental health services. Now, I'm aware that it can be very tricky to even have your loved one access those services. They have to go through the GP, and even then, the GP might not sort of think that they should be referred. But if they are, and if there's emergencies, then what are the waiting times? So obviously, long waiting times for assessments, treatments, or referrals can lead to crises for patients, which gives added stress for carers. So it's in your interest to ask, how are waiting times performing? You can't always rely on the mental health trust to check on those themselves. You should be asking, what's the data? How is this measured? Because as I said, if you're not involved or you feel it's not any of your interest, then there's risk. I'm not saying this is always going to happen, and I'm sure there's quite a few organizations that have good waiting times, but you should be asking. That's one of the most common things to ask because it will affect you. The availability of crisis care. So again, it doesn't hurt to ask in regards to how your trust has effective crisis care pathways. And this could be under emergency mental health teams, crisis helplines, whether they are available 24/7, and also the quality of them as well, to be honest. Care should expect prompt responses during emergencies. Obviously, not the prompt response on the availability of that, but at least when it comes to emergency, you are confident and assured that there's crisis care availability. I think this is one of the most critical one, really. Early intervention. Your local NHS Mental Health Trust should be able to provide early intervention services. So in order to prevent mental conditions from escalating, hence this reduces the need of hospitalization, which can put everything on hold, not only for the patient, but for yourself. and also the focus on crisis intervention. So you should be asking, how is early intervention services being measured? How are they performing? Remember, if you don't ask, there's always a risk that services might decline, and you might have some ideas. I mean, usually when on involvement, they tend to ask for your experience of early intervention, as lived experience. So going to the next one, the focus on quality of care. So effective treatment and care plan. I think this is one of the most difficult ones to have some forms of influence into it. Very tricky. Carers should expect that patients receive individualized care plans. They're not generic, not all the same, tailored to the patient's needs, and should definitely include aspects of how the care is effective and support for the family or carer. Um, Now, these should be regular reviews, not just once every 3 years or 2 years. There should definitely be adjustments. It shouldn't be just done and dusted and that's it. The treatment should be evidence-based and delivered by qualified professional. I'll get onto that in a moment on what I mean by qualified professional, what makes them qualified. But care plans are almost the core aspect when you're trying to provide help and support for the patient or service user, as well as with the professionals. Consistency of care, again, you should be asking, how does your trust provide continuity of care? But the person under care sees the same professionals whenever possible, not chopping and changing the staff, and they keep asking the same questions as the person before, and they don't know the service user and they don't know you, so they assume that the patient has always been this way. And what that leads to is a decline in the service user or patient's consistency of care, quality of care. So inconsistent care can disrupt progress and increase stress for both patient and carer. So if you're involved in shaping mental health services, you're going to ask the trust, how is continuity of care getting along? What's the situation with staff moving around? Are we employing new staff? Can we be involved in interviewing staff so we're assured that they're the right person for that role? That type of thing. Consistency of care and holistic care. Mental health services should consider the whole person. And there is a problem that with mental health trust, they is like what it says on the tin. They tend to focus on the mental health. They tend to focus on the patient and not be holistic about the family or the physical health. So this is what I put down, including the physical health, emotional well-being, and social circumstances. And there's more to it than just that. But those are the great things to include. So carers should, if possible, hold the trust accountable for coordinating care across services such as linking mental health care with physical health services, linking mental health services with social workers or housing support. The big thing about this one is they can't just do like a care plan and then say, get on with it without you knowing what to do, how to do it, or getting support on doing this. There's several questions to ask on this one. And again, it's another lecture. I've got to try and keep this one short. But if you're involved in shaping mental health services at your local mental health trust, it's important to ask how they see the whole person, the whole individual. And this goes under holistic care. So we're now on to our next section on involvement of carers in care decisions. And yeah, this is a big problem. There can be situations where obviously confidentiality is needed. We know that. Respecting the patient's rights. But then there's the other end of it, where carers are not identified, they can be shut out or bamboozled, or they just don't know where things are. So inclusion in decision makings. Carers should be included in discussions and decisions about treatment when obviously the care is appropriate. But if it's not appropriate, it should be revisited. Obviously, this goes down with the consent of the person receiving care. This includes being informed about care plans, being informed about treatment options, being involved in discharge planning. Now, if you start delving and asking about inclusion of decision making and you see a high level of families and carers not being mentioned, not being involved, then alarm bells should be ringing. Um, how is the patient or service user getting support they need? Don't get me wrong, there are plenty of strong-willed, self-sustaining patients out there that need little to no support. But this is not across the board. If you're very unwell, I always put by the rule of thumb, the more people involved, the better the outcome. And this should include families and carers being involved and included in decision making. This, though, is different. Carers assessments. Under the Care Act 2014, and I think this Health and Social Act 2022, carers have a legal right to a carers assessment. And don't get me wrong, carers assessment shouldn't be just about funding. It shouldn't be just about that at all. There's more to it than that. But the carers assessment actually evaluates, and that's why I put down evaluates the needs and the support that carers require. Carers can hold the trust accountable if they are not referred or offered this, or if it's not effectively carried out. Now, some people might be thinking, why on earth should the mental health trust professionals be doing carers assessment? It really does go down to the local authority saying who provides this. And there are issues where the carers assessments tend to be focused on carers caring for someone with physical health needs and not much regarding mental health needs. But there should be carers assessments on those things. And it could be that your NHS trust is carrying it out, and they should say that they are. There should be somewhere on their website, on carers leaflets, that they carry them out and who carries them out. There are also problems, unfortunately, about the quality and training regarding to staff carrying carers assessments. It could be the local authority doing the care assessments. It could be the care centres. Um, but if this is not the case and it's the mental health trust, then as a carer involved in shaping services, you should be asking how many care assessments have been carried out. Um, what's the quality? Who does them? What's the outcome? What's the budget? Don't be fooled, though, to thinking it's just about funding alone. The care assessment serves as a dialogue into understanding the carer's needs and support that they require. It's got to be holistic. There should be another lecture regarding holding to account those, especially mental health trusts, if they carry out care assessment. Some of them might not refer, some of them might not even do it, and they won't tell you. And that means you will be stuck, not just on regarding funding, but a whole lot of other things regarding your carer's rights. So this one's a tricky one. Involvement when it comes to communication and information sharing. This is the big one regarding confidentiality. Trust should really communicate with unpaid carers, providing clear, accessible information about your loved one's treatment, obviously with consent. This is down to the change, whether there's any changes, and you should be, if you're living with them, you should be the first to raise this. And also available support services. This means referring carers back, not just to care centres, but to specialist support options. As a rule of thumb, carers should not be left in the dark about critical care decisions. So getting away from that, and if you're involved in shaping services, you should be delving into how carers are engaged with, that's the key word, how they're engaged with regarding their loved ones or the person that they're caring for, their treatment, and what support, asked to audit how carers are referred to support services. A good um, set of policies, obviously, and I have to give a shout out to this one, is the Carers Trust's Triangle of Care scheme. If your trust is on that, then you're in good hands because there's a set of standards that you can actually use um, in order to get some measurement on how these things are supported. Not just on these, but perhaps most of the stuff that I'm mentioning here. So going on to our next section, support for carers. And again, if you're involved in shaping services at your mental health trust, whether it's steering group, these are sort of things you should be trying to touch on. One of them is care support services. So carers should expect that your mental health NHS trust should offer support services specifically for carers, such as counselling, forms of respite care, or even mental health care support groups that may be held on inpatient wards. I still access quite a few of them. These services help carers manage their own mental health and well-being. And this is really important. We tend to sometimes view unpaid carers as being in the background, just getting on with it, not realizing that they have their own well-being and mental health needs. We consider them to be strong-willed, to be knowledgeable, and to almost predict what might happen. Yes, of course, the patient and service user is worse for wear. They're the ones that should be in the center of support. But there's a risk that this can affect the family if they're not getting that much support. Their own well-being can decline. And if you're involved in shaping services, you should be asking, if you can, how are care supported when it comes to their own well-being. Good example is your mental health trust might have a recovery college, and this is where you can start asking how many carers have been attending these courses, have they been referred, what courses are available specifically for families and carers. It can't be just generic understanding psychosis, understanding eating disorders, self-harm. You'll be looking for anything specific that can help in care awareness training for the carer, and also referrals and the number of care support groups where they run, who runs them, um, what do they cover in those support groups, those care support groups. There's a whole range of questions in holding your mental health trusts regarding these things. Respite care is tricky. I doubt many, if any at all, will be offering that, but there should be some scheme or support that can look into that. And I've touched on a fair bit regarding the recovery college. This is training and education. So carers should have access to training on mental health conditions. Remember what I mentioned, understanding psychosis, understanding eating disorders, whether it's a course, an online course or on-site or leaflet. And there shouldn't be any situations where confidentiality should block that. It's fairly generic. Training and educational treatments, there's still even some things on consent. There should be information, education on treatments, especially if it's tailored, and how to best support the person that you love and care for. Training should also cover how to. Now, I'm always laughing at this because I don't think there is much regarding navigating mental services. That is something that's very difficult because it's almost forever changing for a start. But there should be something on navigating mental health services and what to do in a crisis. So if you're involved in shaping services, something again you can query on holding to account. Emotional support for carers. So your local mental health NHS trust should offer forms of emotional support to carers. And as I mentioned, can often face stress, isolation, anxiety, burnout, depression. It goes on. Carers are at high risk on the role they do. There's no doubt about it. Carers can expect access and they should expect access to care peer support groups. All right, they might be run at your local care centre, or they might be organic, where carers actually decide to run them themselves. I do. Carers should get access to counselling services. Remember, counselling unfortunately can be expensive. You can pester your mental health trust regarding this, but you're more likely to be querying this at your integrated care system, those that fund those services. And when they're funded, or your local authority, it might be based at your care centre. So yes, these are some of the things that you can query with a local mental health trust. On to our next section, respect regarding patient, service user, or carer's rights. Now, carers often have deep insight into the person they care for and their needs. They can't be pushed and bamboozled regarding NHS jargon in order to put patients and carers off, because the professionals are in a rush to get to the next case they have to manage, or they've made a mistake and they want the patient or carer to get onto that. So the trust should recognize and respect carers' knowledge and experience in care planning and decision making. They can't just say, get on with it. You, as a carer, have rights, and you can actually push back if you feel certain things are not in order. And you should be entitled, if something doesn't go right, to complain, because how can mental health services improve if there is no chance for carers to feedback, complain, and also compliment? It's not always down to complaints. Say what is working as well, not what is not always working. Although I can understand feedback is feedback. So there should be respect for the carer's expertise. You spend most of the time supporting person going through mental ill health. You also, and this is 10 times as hard as it should be, unfortunately, patient and carer's rights. You also should ensure that your mental health trust upholds both patient and carers' rights under relevant laws and policies such as the Mental Health Act. Good one is that most mental health trusts actually do have a mental health act department. In fact, you should be asking your mental health trust what is going on at the mental health act department, because as it stands now, the mental health act has is being upgraded, it's been changed, it's been modified. How are mental health trusts preparing for the mental health act? And it's going to take almost 10 years for them to incorporate that act fully into the services. And the Mental Health Act is very tough. There's lots of stuff involved in it. You also got your Care Act, and unfortunately, I don't think hardly any trust does anything regarding Care Act departments. But then where would they sit? Then you've got carers' rights legislation. Who knows this, and how is it incorporated into your mental health trust's policies? And there are a lot of them. You should be asking what policies those rights are included in. This includes also respecting rights to dignity of the patient and dignity of the carers, confidentiality and privacy of the patient and of the carers, and autonomy in care decisions. The most tricky thing is, don't expect the mental health trust to train you in those mental health acts. They might touch on it, but they should at least touch on that, and you feed off as to say, okay, so these are the act and laws, how they're incorporated and how they affect you. It's a very tricky, this one. There's a lot involved in it. This is a big one for me, because I'm involved in the new initiative that's actually come from a recommendation on the Mental Health Act. So that being patient care race equality framework. Don't worry about that for now. You might have to look at my other previous videos. And it's not just patient care race equality framework, or PCREF for short. There are other things. There's culture of care, many other things regarding inequalities and diversity in mental health and public health, social care in general. However, if you're involved in shaping services, you might want to be asking your trust, and you're very lucky. In fact, most trusts now, if all of them, have to incorporate the patient care rate quality framework into services. So that's a good start, but they're not all up to speed. So this makes it quite important that as a carer, that you should hold your trust accountable on culturally sensitive care, which takes into account diverse backgrounds of the patients and carers. Remember, UK is a diverse country. This includes ethnicity, religion, language, gender identity. I'm not expecting carers to hold to account on all those things. That's not possible. But you should be touching on it. How cultural competent is your mental health trust? Is what you should be asking if you're involved in shaping services. This goes on to disparities in care. If you're involved in shaping services, carers should, if possible, hold the trust to accountable on addressing any disparities in mental health care outcomes. A good staff or department to ask is your equality, diversity, inclusion lead, an EDI lead is what they call them. There are other types as well, not just EDI. PCREF leads another, PCREF care lead, service user diversity lead. There's a lot of roles, but you want to be focusing, especially on minority ethnic groups. In fact, a good one is how does your mental health trust engage in stakeholder groups that focus on minority ethnic groups, LGBTQ plus individual and groups, addressing disparities in that, and other marginalized communities. The Mental Health NHS Trust should work actively to reduce inequalities in access, treatment, and outcomes. Without focusing on those things, is high risk of serious incidences um, taking place at mental health trusts. I will do a lot of digging around regarding to examples of these really sad things regarding serious instances and what happens if organizations, mental health organizations, are not held to account on these things. Accountability and transparency. Now we're delving into almost governor territory. If you have um, public patient carer staff governors, they tend to look for this thing. This is the core thing they tend to look for. Obviously, if you're involved as a carer, you may more likely touch on this, but it gets really tricky, it gets really complicated. You're not trained in it, but you're delving into it, and trusts are obligated in some sense. Freedom of Information Act, I would think, in regards to these things. A good one is your complaints, which might sit under your patient advice liaison department, PALS, basically. Complaints and feedback. Remember, I mentioned earlier that carers should be entitled to complain. Don't feel bad about it. You're helping them. You are feeding back. So carers should expect the trust to have clear, accessible processes for submitting complaints or providing feedback. These processes should be transparent, and the trust should take complaints seriously and respond promptly. A good thing I've mentioned here, I should put it in bold. How quickly is your mental health trust responding to complaints and feedback? You should be asking for the data. Hopefully, they can provide that in table form or graph form, and you can measure that maybe every 3 months, quarterly. There should be a period of whether things are improving, and what are they complaining on. In fact, you can link this up with diversity. Is there a lot of complaints regarding discrimination, racism, biases, things like that? Learning, and I didn't mention serious incidents, but learning from incidents. One of the buzzwords or keywords you often hear when a serious incident does happen is we will learn from this. Learning from serious incidents. This is something the NHS Trust would say. But you can only keep learning so much. There's got to be some change. So if there have been any serious instances, well, a number of them, failure in care, preventable death, a good example is problem of restraint if it's taken too far. The trust should conduct thorough investigations and be open about the findings. That is very, 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 very tough. Trusts, not all of them, can dodge and make it really tricky in order to be held to account on these things, and they can bully, and I know it's sad. I'm saying they can literally bully if you're a carer or patient inquiring about those things. It's very serious. Trust can be fined a lot of money if things come to light regarding certain instances. But you should try and ask because at the end of at the end of the road is you that could be at risk if you care for someone and the trust and all these instances are taking place. Who's next in line? Think of it that way. So it's not a good thing to be, not a good place to be if your organization has a higher level of this. Care should hold the trust accountable for learning from these instances and prevent future issues. You don't want to be the next one in line. I, I don't want to scare anyone. I don't think that's the best way about doing this. I'm just saying, hats off to those who are not only caring for someone but taking their time to go and be involved in order to sort of hold their organization to account. When I say organizations, I'm saying the Mental Health NHS Trust. I tend to call them organizations. Again, governor territory, they will look at regular audits and reporting. That's almost all they do. Where's the report on this? Where's the summary on that? Where's the audit? Show me the audit. We want to look at it, explain it to us. However, carers, if they're involved, there's no reason they can't ask. Carers should expect the trust to be transparent, and that's what governors tend to look for. Sometimes missing in that report, and they're going to ask why. They'll be sitting on council of governor meetings, and you'll have your board there, your NHS Mental Health Trust board, talking about report, saying what the challenges are, saying what the performances are, red, amber, green rating, they call them RAG ratings, things like that. So providing regular reports on areas like patient outcomes, waiting time, satisfaction rates, something you want to be asking your NHS Mental Health Trust. The data should be accessible to the public and reflect how the trust is addressing those issues. Not always easy though. Not always easy to do. I think it's never easy. Because remember, you're not going to be training this sort of thing, but you should be asking. Not long to go. I think it was up to 12. I'm really sorry I've made this long. Do skip to certain things you're interested in. I will, as I always try and do, split sections in the video. Go to the video description and click on certain settings. Now, this is the big one. Adequate staffing levels. This is something NHS England's often pulled up on regarding staffing levels and the training of them. Remember at the start of this lecture, I did say the situation about how well the staff are trained. Has sufficient staffing. If you're involved in shaping services, if you're in steering groups at your local mental health trust, you might want to be asking your mental health trust, what are the adequate staff? What are the staffing levels? How are they adequate? What makes it adequate? So that mental health services are not understaffed or overwhelmed, which can lead to poor patient care. In fact, it leads to you, the carer, doing the work of the staff. This includes both frontline mental health support workers and support staff. And this is what I was talking about at the start of this lecture. Continued training for mental health professionals. And I said this should be regular, high quality training to ensure it's up to date with the latest treatment methods, cultural competence, what I was mentioning before regarding tackling discrimination and biases, and how to involve carers. This is basically care awareness training in care planning. If you're a carer, you can hold the trust accountable for ensuring ongoing professional development and education. Now, I know it's really difficult because the rising cases, numbers of cases professionals have to do. And don't get me wrong, should be trained, but it's getting more increasingly difficult. It's well known care awareness training is not mandatory for that reason, because it's just not enough time. But it doesn't hurt to ask and find other ways of how that training could be incorporated. And there should definitely be the keyword here when it comes to training is co-production as well. Not too long ago, crisis and emergency care, so accessible crisis services. Mental health trust crisis services should really actually be easy to access, and the trust should have systems in place for carers to get urgent help when needed. Carers can ensure and should ensure that the trust has a clear crisis plan and that it works effectively when those situations arrive. We've also got the hospitalization and discharge practices. So if, unfortunately, in the case hospitalization is necessary and needed, then the trust should ensure the process as smooth as possible, with a clear discharge plan that involves carers. The trust should be held accountable for not discharging patients too early. This can happen because of the lack of beds or without sufficient community support. So it's not just, you know, discharge to the carer, but there should also be forms of community support as well that the patient and carer can use. On to our next bit. So ensuring support after the discharge and transitions onto other services. There may be situations that the mental trust can only have the patient in their service maybe 6 months. Some would be indefinite, depending, obviously, it depends on the mental health need. But when it comes to post-discharge support, carers should expect that a patient is discharged from the hospital or mental health facility. They are not left without some form of support. There should be follow-up care. Good, I think, what's the good one? From the community mental health team. Home treatment team should be available, just see how things are developing. So they're eased into the support of the family or friend. Should be access, as is mentioned, to the community mental health team and a clear care plan. Coordination between services. So if the patient is being transitioned to different services or form of care from hospital to home, the trust should ensure that the process is coordinated and that all parties are involved, including carers who are informed and supported. You might think, how on earth can you hold your trust to account of those things? You can. I'm not saying it's easy, obviously it's not. But the first thing you'd be saying is, what is the coordination between those services? How long does it take? Who's responsible? Who measures these things? And those are good starting questions regarding how services are coordinated. This is where it starts about technology. Because of funding issues, there's not enough money to go around. This is where you want to be asking, okay, where we have to now think out of the box on how can we improve services. So one of the things is incorporating feedback for improvement. Remember what I said earlier? You should be encouraged to feedback, complain, because how will those services learn? So carers should expect their mental health trust to continually strive for improvements to get that good rating when the CQC comes along and inspects. When I say CQC, I'm talking about the Care Quality Commission. They give mental health trusts their license to run those services. So improvements for mental health services, taking into account feedback from both service user and carer. Trust should be open to innovation and change to enhance care delivery. The biggest one on change is patient and care involvement, co-production. This is a way of incorporating improvement and feedback and innovation. And coming from a technology background, I understand the importance of using technology, which is increasing rapidly. Carers can and they should hold the trust accountable for using technology, such as telemedicine, digital tools, digital apps. I know I'm going to give a shout out Kent and Medway Mental Health Trust have been developing a lot on online um, applications for carers to use. And, I'm all for that. It's not just that, there's many other things mental health trusts can do. I'm involved in Kent and Medway. So to improve access to mental health services, especially in rural and underserved areas, we're now delving back into um, looking into e- equality of services. So advocacy and legal support, not an easy one, this one. This is now where we're delving back into triangle care, um, use of rethink mental health centers, mind centers. How does your mental health trust work with those groups, with those services? So access to advocacy services, carers and patients should have access to independent advocacy services to help navigate mental health system and understand their rights and roles and represent their interests. And they don't have to be straight to the advocacy services. You can have them in-house, an independent mental health advocate, approved mental health advocate. Um, you can have them outside as well. But it should be how does your organization work with them? Care advocates. I know, and another shout out to Signet who actually have care advocate, which is really good. I also have CALS specific to feedback and complaints coming from carers. Legal support for carers. So, and this is we're going back into acts and laws again. If necessary, carers and remember, I'm not just saying what should be happening. And I'm sort of mentioning you as a carer need to ask what is the legal support for carers. Don't just have the mental health trust say, oh, well, they can just get themselves a solicitor. There should be a list of solicitors if your loved one has been sectioned. So, but going away from that, carers should have access to legal support and patients as well, obviously, if they feel that the trust is not fulfilling its duties under the Mental Health Act, Care Act 2014, or relevant laws. But then you should be asking, well, if you're not fulfilling the duties, where can the carers get legal support? I'm not saying the trust has to provide solicitors. There should be a list of them and they should be working with them. So to wrap this up, and I'm sorry if it was a very tricky lecture. I've not done it justice. There's a whole lot more involved in this, a whole lot more. Probably only covered 1%, but I promise to revisit and put things into steps and why it's so important. You should be holding your trust to account on it. There's a lot of other things missing as well. But in summary, carers they can. You can hold your mental health trust to account. There are problems about time and that you you want to live your own life and work on education, get yourself into work. But given the chance, you can hold your NHS trust accountable by focusing on the areas, and they're only just some of it. I've missed that stuff. I think, child and adolescent services, specialist services, parity esteem, working with acute trusts, and they are behind a lot of the acute trusts on involvement, co-production. The culture is very different compared to mental health trusts. I should know. I'm involved in many of them, many mental health trusts. But there should be, as I said, if they have the groups, steering groups, you need to try and ask as a carer on the quality of treatment, involvement, co-production in decision making, and involvement when carers are caring for someone, how they're involved in decision making, and support for the patient and carers. It's in your interest. You're tied to this, even if your loved one struggles to get access to those services. What improvement can be made for early intervention? I'd like to say thanks for dropping by this lecture. I hope it's been of use. Um, it's good that we touch on this, and I'm hoping my YouTube channel stays up so people can refer and have a read. And we'll obviously try and convert and translate this all down into a blog as well. I'd say if you're caring for someone, do look after yourself. It's very difficult these days, but it's so important that you do because if you can't look after yourself, How can you expect to look after anyone else? Thanks for watching. See you later.